Gentlemen, everything you've been told about penis size is about to be turned upside down. For decades, magazines, movies, and locker room talk have drilled the same message into men's minds. That bigger is always better, that if you were just a little longer, a little thicker, life would be perfect, confidence would soar, and women would fall at your feet. But after 30 years as a urologist specializing in men's health, I can tell you, that belief is not only wrong, it can be dangerous. I'm Dr. Mohit Khera, and I've examined tens of thousands of men from every background and every size. I've seen the truth up close, and it's nothing like the fantasy most men imagine. Here's the paradox. Some of the happiest, most fulfilled men I've treated have average or even smaller than average penises, while some of the most frustrated, regretful patients I've met are the ones with extra size. How can that be? Because there are 5 surprising, medically proven, and life-changing truths about large penises that no one ever told you. Truths that will make you rethink everything you thought you wanted. By the time we're done, you'll know why being in the middle of the size spectrum can protect your health, improve your intimacy, and make your later years far more comfortable. And when we get to the 5th truth, you'll hear a story so unexpected that you may actually feel grateful for what you have right now. So stay with me, because what you learn today might free you from a lifetime of needless worry. Before we get started, make sure you subscribe and turn on the notification bell so you never miss important men's health advice tailored for you. And after you've listened, leave me a 1 in the comments if this opened your eyes, or a 0 if you think I can make it even better for you. All right, gentlemen, let's get into the first truth. It's one most men never think about until it's too late, and it can change your life in a single, painful moment. I'm talking about how a larger penis can actually break more easily, and why the risk grows as you age. Truth number 1, bigger breaks easier. I've been a urologist for over 3 decades, and I can tell you there are moments in my office that men never forget. One of them is when I have to explain that yes, a penis can break. Not in the way a bone snaps because there's no bone inside, but in a way that is far more unsettling. It's called a penile fracture, a tear in the tough outer sheath that surrounds the erectile chambers. It usually happens in the heat of the moment, when the penis is fully erect and under pressure. In that state, the tissue is stretched to its limit, almost like a balloon filled to the brim. One wrong angle, one sudden thrust, or one slip during sex, and that stretched tissue can rip. The result is an audible pop, immediate loss of erection, bruising, swelling, and intense pain. Now here's where size becomes a disadvantage. From a purely mechanical standpoint, the longer the shaft, the greater the leverage when it bends. That increased torque puts more strain on the tunica albuginea, making it easier to tear. Think of a long tree branch compared to a short one. The longer branch takes less force to snap if it's bent sharply. For men over 60, the risk is even greater. As we age, the tissues become less elastic, blood flow isn't as robust, and recovery from injuries takes longer. Combine that with a larger than average penis, and you've got a recipe for trouble. I've seen this happen most often in certain positions, especially those where the partner is on top or during rear entry, when control is harder to maintain. In fact, studies show doggy style carries the highest risk of fracture. I remember one patient vividly, a man in his late 60s, proud of his size his whole life, who came into my office pale and shaken after a mishap during intimacy. He needed emergency surgery. We repaired the damage, but his erections were never quite the same afterward. He told me later he wished someone had warned him about the risks years earlier. If there's one thing I want you to take from this, it's that size doesn't just bring bragging rights, it brings vulnerabilities. This is not a scare tactic. It's a reality I've witnessed countless times. Protecting your sexual health means knowing the risks and adjusting accordingly, no matter how many decades you've been active. And while this first truth focuses on the bedroom, the second truth takes us somewhere you might not expect. The operating room. Where being too big can turn a routine procedure into a medical nightmare. Truth number 2, the surgery struggle. Most men never think about how the size of their penis could matter in the operating room. It's not something you brag about to your doctor, And it's certainly not something you imagine could ever work against you. But after more than 30 years as a urologist, I can tell you it can. And I've seen it happen more times than you might believe. Many of the surgical tools we use in urology, particularly those for procedures done through the urethra, are designed for the average male anatomy. That means they're built to navigate a certain distance with precision and control. When the penis is significantly longer than average, that extra length can turn a straightforward procedure into a technical challenge. You might be thinking, so what? Isn't it just a matter of pushing the instrument farther? I wish it were that simple. The further we have to reach, the more awkward the angle, the harder it is to maintain accuracy, and the higher the chance of causing unnecessary trauma along the way. This becomes a real issue as you get older, because the odds are high that at some point you'll need a transurethral procedure. For most men over 60, an enlarged prostate is almost a given. When urination becomes difficult or frequent, or when the bladder can no longer empty fully, surgery may be the best solution. In a man with an average-sized penis, the instruments we use can reach the prostate efficiently. In a man with a much larger penis, we sometimes have to improvise, and improvising in surgery is never ideal. I still remember a patient in his 70s who came to me needing a routine procedure to relieve his prostate obstruction. He was in good health otherwise, but his anatomy made the operation far more complicated than expected. What should have been an hour in the operating room stretched into several, increasing his risk of bleeding and infection. He recovered, but not without extra pain and a longer healing period. Afterward, he told me he'd never imagined his size could be a liability, especially when it came to something as unrelated to sex as prostate surgery. These are the kinds of realities men aren't told about when they're younger. And while it may feel strange to think of your penis size as a potential surgical disadvantage, it's far better to know it now than to learn it in the middle of a medical crisis. If the first truth was about a sudden injury that could change your sex life in an instant, and the second truth reveals how size can complicate critical medical care, the third truth takes us somewhere even more personal, into the everyday frustrations you might face in one of the most private places of all. Truth number 3, bathroom blues. It might sound trivial at first, but I promise you, any man who's experienced it knows just how frustrating and downright unpleasant it can be. I'm talking about the simple act of using the bathroom. You would think something so basic wouldn't change much from one man to another, but the truth is, having a larger penis can make it far more awkward than you might imagine, especially as you get older. Let's start with public restrooms. In America, many toilets are designed with a water level that sits high in the bowl. That means when you sit down, there's not much clearance. If you have a longer penis, you can end up dipping into cold, germ-filled water without meaning to. It's a shock you'll never forget. And one you'll do anything to avoid repeating. In Europe, the design is different, but the problem doesn't go away. There, the water level may be lower, but the front of the bowl often comes up higher, which means contact with cold porcelain is just as likely. Neither is something you want, especially in a public restroom where cleanliness is questionable at best. For younger men, maybe this is just a rare inconvenience. But for men over 60, the likelihood of facing it more often increases. Why? Because age brings changes. Enlarged prostates, weaker bladders, or medications that increase urination can mean more frequent trips to the restroom. And as joints get stiffer or balance becomes more delicate, sitting down to urinate might become the safer choice. When you have to do that multiple times a day, suddenly the design of that toilet and your own anatomy starts to matter a lot more. I once had a patient in his mid-60s who confessed he avoided certain rest stops on long drives because he knew exactly which ones had the high-water toilets. He would plan his trips around them. His wife thought it was a quirky habit. To him, it was about avoiding constant discomfort and the embarrassment of an accidental splash in public. It's small details like these that most men never think about when they wish for more size. They imagine admiration, not awkward moments in the most private of places. But life has a way of humbling all of us, and the truth is, what seems like a blessing in one context can be a nuisance in another. And while this truth deals with the private frustrations of daily life, The next one moves into even more intimate territory. The bedroom, where a mismatch in size can turn something meant to bring pleasure into a source of pain. Truth number 4. Painful mismatches. Over the years, I've had countless conversations with couples who came to me for help, not because of a lack of desire, but because intimacy had become physically difficult, even impossible, to enjoy. Many men expect that a larger penis will always make their partner happier, but the reality is far more complex, especially as both partners age. A woman's body changes over time. After menopause, the vaginal walls can become thinner, less elastic, and more sensitive. Natural lubrication often decreases, and pelvic floor muscles may weaken. For a woman in her 60s or 70s, penetration that might have been comfortable in her younger years can now feel tight or even painful. If her partner is significantly above average in length or girth, the experience can quickly go from pleasurable to distressing. I remember one couple in their late 60s who had been happily married for decades. They still loved each other deeply and wanted to stay physically intimate, but every attempt at intercourse left her sore for days. They had tried lubricants, longer foreplay, even different positions, but nothing seemed to help enough. He was heartbroken because he felt responsible for her discomfort, and she felt guilty for dreading something they once both enjoyed. In their case, counseling and careful adaptation to their sexual routine allowed them to remain close, but it required honest communication and a willingness to completely change how they approached intimacy. This isn't an isolated problem. Larger size can limit the variety of positions a couple can comfortably use, and it often requires more preparation and gentleness to avoid pain. While some couples can adapt successfully, others simply stop having intercourse altogether, relying instead on other forms of intimacy. I've seen many men with average sizes continue to enjoy active, passionate sex lives well into their 70s and 80s precisely because they didn't have to constantly work around these physical limitations. And this is a reality that many men never consider when they imagine what life would be like with a much larger penis. In their minds, size is always an advantage, when in truth, it can sometimes be the very thing that robs a couple of sexual closeness. But not all challenges of being larger happen behind closed doors. In fact, the next truth is about something you can't completely hide from the world: the attention, the assumptions, and sometimes the trouble that can come from everyone knowing exactly what you're working with. Truth number 5. The social spotlight you can't escape. When you're noticeably larger, it's not something you can completely keep to yourself. At some point, in certain settings, other people will notice. And once they do, the attention can follow you for years. I've had patients tell me they expected this kind of attention to feel flattering, maybe even a little empowering. And yes, at first, it can stroke the ego. But over time, it often turns into something far more exhausting. Locker rooms, public showers, medical exams. These are places where privacy is limited and word spreads quickly. Among friends, the jokes might seem harmless at first. But imagine hearing them every single time you walk into a room. I've treated men who have been the subject of whispered conversations in the gym, who've had strangers try to sneak photos in the locker room, and who've been asked invasive, personal questions by people they barely know. One man in his 70s told me he'd been living with this kind of attention since high school, and it had made him guarded, even distrustful, about forming new relationships. Then there's the assumption problem. Some women may approach you with a certain expectation, seeing you more as a curiosity than a person. Some colleagues or acquaintances may assume you're showing off when you're not. In rare cases, it can even cross into accusations of inappropriate behavior, simply because of how your anatomy appears in certain clothing. For a man who values his reputation, especially later in life, these misunderstandings can be deeply damaging. One patient confided in me that he stopped going to his community pool altogether after a photo of him in swim trunks circulated online without his consent. It wasn't explicit, but it sparked gossip that followed him for months. The very thing he thought would be a lifelong blessing had, in many ways, become a burden he couldn't set down. This constant awareness that you're being observed, and often judged, can wear on you. It makes it harder to relax, to feel at ease in social spaces, and sometimes even to trust the intentions of those around you. And while the challenges we've talked about so far, injuries, surgeries, bathroom frustrations, intimacy issues, are more private in nature, this one follows you into the public sphere. It becomes part of your identity whether you want it to or not. And now that we've gone through all 5 truths, there's one final perspective I want to leave you with. One that might just change the way you think about your own body for the rest of your life. Conclusion. After decades of listening to men share their deepest insecurities and seeing firsthand how these concerns play out in real life, I can tell you this. The size of your penis is far less important than you've been led to believe. We've walked through 5 truths today. The increased risk of injury, the complications in surgery, the unexpected frustrations in the bathroom, the painful mismatches in intimacy, and the constant, often unwanted social spotlight. Each of these on its own is enough to make you think twice about whether bigger really means better. Together, they paint a very different picture than the one you might have carried in your mind for years. I've met men who would have traded a little of their size for a little more peace of mind, men who realized too late that the fantasy they chased came with challenges they never anticipated. I've also met plenty of men with average or even smaller than average penises who lived full, confident, deeply satisfying lives. They didn't spend their days worrying about measurements or comparisons. They invested their energy in their health, their relationships, and their sense of purpose. As a doctor, I care about the whole person sitting in front of me. I see beyond the numbers on a chart or the inches on a ruler. I've learned that confidence comes not from the size you were born with, but from how you carry yourself, how you care for your body, and how you connect with others. A healthy heart, strong circulation, balanced hormones, and a willing, compassionate partner will do far more for your quality of life than any extra length ever could. If you take anything from our time together, let it be this. Your value is not defined by what's between your legs. Whether you're 60, 70, or beyond, your ability to live fully and love deeply depends on how you look after your health and nurture your relationships, not on the size of your anatomy. The truth is, nature has a way of balancing things out, and most men land right where they should be, in that comfortable middle ground where there are fewer risks, fewer complications, and far more freedom to enjoy life without constant worry. So instead of chasing an illusion, take pride in what you have and focus on what you can control. Stay active, eat well, keep your blood pressure in check, talk openly with your partner, and see your doctor regularly. Those are the things that will keep you strong in the years ahead. And remember, the next time you catch yourself wishing you were bigger, think about the men who've had to face the challenges we've discussed today. Many of them would gladly stand in your shoes. And perhaps that's the final truth worth knowing, that contentment comes not from getting more, but from appreciating what you already have.